I don't think the people of Lucas County realize we have an infant mortality problem, and especially within the African American community, because it's just not something that's talked about a lot.
Our infant mortality rate is that of a third world country. This is 2018, it's the United States, this is Toledo, Ohio. Our infant mortality rate should not mirror that of nations that have less resources than we do.
Our goal is not to just improve infant mortality, it's to eliminate the racial disparity that occurs in the opportunity to survive the first year of life.
He looked like he looked over for a minute and then he just died. And the nurse picks him up and I'm trying to run off because I can't believe this. And they said, no, you hold your baby. You hold your baby. So I hold my baby. And the last thing I just remember is his warm body going cold. And I just remember that. And
We're going to tell a story illustrated in black and white. It's a story about people who never had a voice because they didn't survive birth. Yet they speak. They speak volumes about the disparity between black and white. Consider this. Nationwide, between April 2016 and March 2017, the mortality rate of white babies was 6.3 per 1,000 live births. Among black babies, the infant mortality rate was 12.7. In Ohio, during 2017, 5.2 white babies died per 1,000 live births, compared to 15.7 black babies, over 3 times the number. And here in Lucas County, 6.7 white babies died per 1,000 live births, compared to 17.5 black babies.
In our urban centers in Ohio, we see a markedly higher rate of infant mortality, and there is 3 times greater infant mortality in our African American population versus our white population. But overall, as a state, we perform poorly.
Dr. Kent Bishop is concerned about these lost young lives. He's Chief Medical Officer for ProMedica Physicians and a Fellow of the American College of Obstetricians and Gynecologists.
Over 1,000 babies a year in Ohio pass away before their first birthday. And we know that's not acceptable, but I'm not sure that every Ohioan knows that that's going on.
It shouldn't be like this. Dr. Arthur James is an OB/GYN and pediatrician at Nationwide Children's Hospital in Columbus and member of the Department of Obstetrics and Gynecology at the Ohio State University Wexner Medical Center.
In our efforts to try to improve infant mortality in the state of Ohio, one of the things that we proposed was the development of the Ohio Institute for Equity in Birth Outcomes. What we did was to look at the 9 to 10 counties throughout the state that were the most problematic for not just infant mortality, but also black infant mortality. Lucas County happened to be one of those counties. It's not just a medical problem. Some of the most significant contributors are non-clinical, non-medical. And policy plays an exceptionally important part in all of this. And so, having come here in 2011 and listening to, you name it, clinicians, politicians, local community members, leadership at various state agency levels, the perception, generally speaking, was the following. That yes, the state of Ohio has a high overall infant mortality rate, that the state of Ohio's high overall infant mortality rate is high because of our embarrassingly high black infant mortality rate, and that our black infant mortality rate is as high and as bad as it is because of group level flaws amongst those of us who are black. that's not the case. Ohio's white infant mortality rate was also unacceptably high. And it was unfair to say that our overall infant mortality rate was high because of group level flaws amongst those of us who are black, when we were not also willing to say that our overall infant mortality rate could be high because of group level flaws amongst those of us who were white. In fact, group level flaws amongst any group is not what accounts for our elevation in infant mortality rate. It's that from a programmatic perspective, from a social determinants perspective, and I also believe from a clinical care perspective, infant mortality wasn't receiving, and in my opinion in our state still is not receiving, the level of attention that it deserves.
It's just due to the everyday stress of dealing with structural racism, which also relates back to the other social determinants of health. So racism is a social determinant of health in addition to housing, education, finance, all those kind of things. So when you're dealing with racism and inequalities and inequities on an everyday basis, it creates a whole nother level of stress that African American families have to deal with.
It shouldn't be like this. It doesn't have to be like this. Dr. James has seen other communities make a difference.
In Kalamazoo, Michigan, where I was before I came here, I had the privilege of leading a community effort to help improve infant mortality. At the time I was there, Kalamazoo County had the highest black infant mortality rate in the state of Michigan. And at that time, the state of Michigan had the highest black infant mortality rate in the United States. We were able to improve things in Kalamazoo so that the black infant mortality rate improved from 29.7 deaths per 1,000 live black births down to 10.2 black infant deaths per 1,000 live black births.
Getting to One is part of the Ohio Equity Institute and is coordinated by the Toledo-Lucas County Health Department and the Hospital Council of Northwest Ohio's Pathways Hub. Among many efforts to reduce infant mortality in Lucas County, Getting to One is addressing structural racism as a social determinant of health. We will now hear from 6 area African American families who will share in detail their own stories of babies lost to infant mortality. We will hear how those losses have impacted them, what they've learned along the way, and how they hope their stories will make a difference in eliminating the disparity between black and white infant mortality rates. We will see that, indeed, infant mortality is a matter of black and white in Lucas County.
We wanted to go to college, and graduate, and then start a family. That's what we wanted to do.
But when you got the news, that changed your opinion about things.
Oh, most definitely.
Tell
Once
me-
you hear the news, you can do nothing but be happy, And we were very happy together,
Yeah, she was planned.
She was playing once we got around it, I don't know.
She was planned.
Did you have a notion at some point along the way that there were difficulties with the pregnancy?
Yeah, it was her heart. They seen it on. They seen that something was wrong with her heart, and they told me right away. And then I didn't have enough fluid in my stomach, and the doctor asked me if I wanted to terminate my pregnancy. I said no. I wanted to go ahead, and she survived the whole pregnancy, but after I had her, she didn't make it.
The first appointment that I went to is when I got the full scope of what was going on. And I was devastated, and it was very emotional. I think my son ran out of the room, ran out of the hospital, and Tierra was very upset, and they wanted her to make a lot of decisions at that point as to what to do. And I felt totally helpless, to be very honest, and didn't really know how to advise. But it was just all bad news.
Well, he asked me if I wanted to terminate the pregnancy. I was never going to do that. I had in my mind that I was going to go through with the pregnancy. So.
Well, I remember it just being like one long, very bad day. Me and Tierra was not getting along. I didn't know like my left from my right. You know how those days are. It was just really hard. Some days it was just hard to get out the bed. But at the same time, I had another son to raise, so I had to, push through it. But it was really difficult. Just like going back to work, all those kind of things are just hard after you lose a child. Like, it's probably the most difficult thing you can do. Just not want to associate with other people.
That's what I did. I stayed in the house. I didn't want to talk about it. I didn't want anybody to ask me about it. I didn't feel like I could talk about it. All I just wanted to know was why. That's all I wanted to know.
Part of what I do is to help people. That's what social workers do. We're professional helpers. And so I went into help mode, but I needed help. And the first thing is that I was in total denial. Even the day that she passed, I got to hold her just before she took her last breath. The thing that I did was I left the University of Michigan Hospital and I came right to work. And so it was like I had to do something. And so in my profession, I deal with children that pass. I have to make life and death decisions for them. But when you're in this situation, you really need to help yourself. Every single day, I'm making decisions about children. But honest to goodness, until you experience this yourself, I can't even explain what it does to you. And yeah, we have Pete now, Pete the Fifth. But every day I think about Rose. And Levi does not let any of us forget. When Pete the Fifth got christened at the church, Levi thought the church was heaven. And so his comment, he was walking around the church asking people, "Where's Rose? This is heaven, so I'm supposed to see Rose." And it was like, oh God, how did you explain this to him? He's 4 years old. But I guess he saw the pictures of Jesus and everything, and he was like, this is heaven. So I need to see my sister. And so, it's just something that you just don't get over. I knew all of the statistics. I know all the data. I know all of that. Like I said, my first doctor's appointment that I went with Tierra, that's when I got the full scope of it. And immediately I started thinking, okay, so first spiritually, I was thinking, I'm gonna pray about this. She's gonna be okay. And then the other thing is, okay, so she's born and she has special needs or whatever. We're gonna all just pitch in there and it's gonna be okay. So up until the day she was born, I honestly thought it was gonna work out. I really did. I'm gonna be honest, I was very worried because they're always under a lot of stress. And so I was really worried, knowing the research. I was worried about that would have some impact. Just the struggle, trying to get their education in, careers, and with my son, I'm gonna be honest with you, as a mom, you can never relax when you got a black son. And he's had his little brushes with situations that made me worry constantly. At one point, I think he was stopped by the police almost every day. Yeah. He could be sitting in front of the house with music on and he would get stopped. And just having all of that and them being so young, I was afraid that the stress would be too much. And so, as a mom with both of them, constant worry.
Yeah, I'm well aware of the stress, being like one of the top killers of black men and black people, period. And the infertility rate, I read about that in school. And I just don't understand why it's such the ratio is just so different from whites to blacks, when it's more white people than it is black people. I think that might stem from a lot of black women going to college don't have the same resources that a white woman has that doesn't even go to school. Because a lot of black women, you know, they might come from a bad demographic, but they're trying to do something different than the people around them. So they're just getting themselves through school without having those like parents at home. Like for instance, my girlfriend, she went to school, but like she didn't have any help while she was there. So the stress level was much higher than from somebody that would come in with parents that want to help and all those kind of things, you know.
They never brought up stress to me. The doctor just told me that she might not survive past second trimester. That's what he told me. I thought that when I got pregnant for the second time, I thought I would be elated. That was not the case. To be totally honest, after I got pregnant, I really didn't want to be pregnant anymore. I was scared, I was nervous, I was anxious, hoping that the same thing wouldn't happen to him. Is he going to make it? They're telling me he's fine now, but is that going to be the case the second trimester? It was horrible. I'm just glad it's over, and I'm glad he's fine.
I think all of us were worried.
Yeah.
Every day we were
I
worried.
probably was the most worried.
Even worried after the fact, even though he was here. It makes you worry.
Yeah.
And so I'm to the point to where I'm like, I don't want any more kids because the stress level is so high, you wouldn't believe it. It's just, I don't know. I'm happy I have them, but it's hard. I will always have that thought because Rose, like I said, was planned. She was not a mistake. I wanted her. I still ask why. Nobody could ever tell me why, but I'm not interested.
You know, this was the part that kind of shook me when the bad news started coming. The one appointment that I was at, I thought they were very cold and callous.
Yeah.
His bedside manners.
It was callous to me.
Yeah. At some point, you start getting treated like a number or a statistic. Because I don't know if it's because they see it far too often, but you want to be treated as an individual. But at a certain point, I just start feeling like a statistic or a number.
With that specific doctor.
Yeah, I think it was just maybe it was a doctor we were dealing with. I don't want to just categorize it as racism, or it was just him just being so far into his job. But I did feel that we were just being treated a little unfairly and a little cold-hearted.
Yeah, and even like I said at the hospital, they didn't seem that open to sharing information with Pete.
Yeah,
I got
that too.
You kind of just talked to me.
Yeah, like she was the only one in the room, and and he's falling apart. He's the one running out of the room because he's falling apart. He doesn't understand what they're talking about. There's not a lot of explanation, and he's just overwhelmed with the whole situation. And we're trying to comfort Tierra and comfort him. It was a nightmare.
For anybody that does go through anything like that, don't be afraid to get help. Get as much help as you can, get as much counseling as you can. Talk to people, don't hold it in. Don't be stubborn like I was and let it get worse, because that's why my anxiety level is this high. That's why my depression is the way it is. And it's getting worse and worse. You don't want to do that to yourself. A lot of people tell me to hang in there, but that's much easier to say than to do, because I am a strong person, but you can only be strong for so long. I don't think people get it, but support is everything.
So one of the things that I noticed about Pete is that through this, he'll talk, he can talk about it himself, but this pushed him to get a good understanding of how important fathers are in a child's life. Me and his dad, I think we've always been there for him, and maybe to some degree he didn't realize how important it was, but he's a real advocate now for fathers, even before you have the baby. He's a real advocate, great dad.
Off camera earlier this evening, you were telling me that it's actually getting harder.
It is.
But you're here and your story is an important one that needs to be told. Something brought you out of your shell.
Right.
You wanted to talk about this because you wanted other people to know.
And I want to help other people. I want them to know that it's okay to talk about it. You don't have to hold it inside. It actually helps to talk about it now that I'm not being so stubborn, but I don't know.
How's it going for you?
Honestly, I had a story. Along with my mom, the social worker at the hospital kind of like enlightened me and opened my eyes to want to get back on my path, and it made me, signed up for school, and now I'm pursuing my social work degree. I got accepted into the social work program in my school, and things have been looking up, and me and Tierra, we have our days, but we are like strong, and we're gonna get married soon, so I think we're pushing through it, but it's hard, I know especially for her, because she has this guarded personality, and like experiencing that trauma is really detrimental to anyone. So I think this is the best thing for her to open up, besides talking to me, because she has a hard time talking to people about it, because it's a real sensitive subject, but I swear this is like the best thing to happen to both of us as far as this goes.
I knew that it was gonna be rough because after I found out that it was twins, I had everyday sickness. Like, it wasn't no just morning sickness. It was, I can be laying in the bed and I feel like I have to use the restroom, I have to go throw up, or I can be eating ice and I have to go throw up, or anything, just brushing my teeth. Everything went downhill. Then I had to be on a home IV. It got very, it made me nervous and it got serious. Like, sometimes pregnancies can be like, oh, happy, and, my belly. But it was more of something's wrong. Like, I keep throwing up. Like, I know it's twins and it give you different symptoms, but it was something that was telling me something was wrong.
It was very stressful and scary. At the time I was working 2 jobs and in school full-time, finishing up my undergrad degree at the time. So it was scary because I couldn't be home with her. She was on bed rest. So I wanted to be home with her, but at the same time I wanted to be in school because I wanted to finish my degree and then also work, so that way, because we had long-term goals of getting our own place. So I knew we had to kind of balance, and I had to make some sacrifices. I feel like I did as much as I could, but I wish I could have done more. I think, if that makes sense. I know that it was out of our control. I get that, but at that moment, I didn't understand. And I really do wish that I could have been there more. As I said, I had school and I had work, but I wanted to be there more than I was able to be there.
Stress does play a big part in pregnancies. I can say that personally. I was going through a lot of stress. I was in school for cosmetology, and then, I had my mom that wanted to tell you, her opinion. I felt like it was kind of stressing me out because as a 21-year-old, I feel like I had that decision to make it my own. But stress, it do play a big part in pregnancies. Before I got pregnant with the twins, I did have a miscarriage. About 3 months before I got pregnant with them, I had a miscarriage. I wanted to wait, but at the same time, when you lose a kid, it's very hard because it feels like you're missing something. And it's not just something, you're missing your child. When I was pregnant with the twins, it was more of me not knowing that, I have to stay on top of my doctor's appointment. I have to make sure I'm taking my prenatals every day, making sure that, that I keep on top of my body, and just making sure that I am a positive move, because like I said, stress can play a big part of being pregnant.
For the delivery, I noticed right around like December 16th, I noticed I was leaking some type of fluid. And so I called my doctor. My doctor told me, just put a pad on. So the morning of I was calling back and forth, and they said, no, you don't need to come back up here. You don't need to come up here. And I said, okay, I'm going to listen. So on the 19th, I woke up, and something just told me, oh, something's about to fall out of you. There's a towel in the middle of the floor, and just push. So I went over to the side of the room, and I pushed, and fluid came out. So I screamed, and I said, Mom? And she said, oh, she came in the room, and I said, what is this? She said, that's water. She said, something wrong with you. She said, I'm gonna call the ambulance, and she wiped me up and cleaned me up and helped me get down the stairs. So the ambulance came and got me, and I went to the hospital. And before the doctor came in to swab me, the nurse that's been there for like 30 or 40 years, she looked at me, and she looked at my vaginal area, and she said, I think you're right. That looks like water. That looks like membranes. You're right. The doctor came in, swabbed me, and he called it a UTI. And I said, no, this is not a UTI. I'm not burning. So he sent it to the lab, and he did an ultrasound, and he said, if you are leaking, you have enough water to make it. And so my mom walked up, it's winter too, my mom walked up there with my 2 other kids, and she explained to the doctor, she said, no, something's wrong with her. She has never had nothing like this before, and I'm concerned, and I don't want to keep handling this situation. And he proceeded and said, no, she's going home. So they called me a cab, and the main entrance, they set me in the lobby to wait for my cab, and I felt something pulling on my stomach, from my stomach, and I thought it was contractions. It hurt. I thought somebody was just pulling at me. And the clerk at the time, she said, no, something's wrong with you. You in labor, something's going on. You going back upstairs. So the nurse came back downstairs, and she touched my stomach. She said, no, that's not a contraction. I said, this is something, because this hurts. So they take me back upstairs, and this time they just put me on the stress machine, and the baby didn't go into distress yet, because they don't do that right off the bat. And he came back and looked, tested my cervix, and I said, look, I'm bleeding. And he said, it's just your cervix. Because I checked your cervix, it's gonna bleed a little bit. I said, no, it's really bleeding. I said, this is gushing. Something's wrong. But I took his word, and he sent me home. And so I got home, and I just noticed I was just in pain, and something just said, go to sleep. I prayed, and I said, Lord, if I'm dying, let me have a peaceful death, just in my sleep. Just take me in my sleep. So I guess I make it to the next morning, and I do my morning pee, and I notice red, bright blood. So I called back at the hospital, and the nurse I had the day before, she kind of had an attitude this time. She had a whole attitude. Well, we told you your cervix was going to bleed a little bit, and that's probably what it is. So I believed her. And that whole day it was just cramping, and I ordered the boys pizza and told them to go to bed later on. This is December 20th now. And I go upstairs and try to get comfortable, but I start cramping real bad, and I did the thing that they tell you never do, is to sit on the toilet. So I sat on the toilet, and I noticed I'm bleeding. Blood is everywhere. Blood is on my floor and on my toilet seat. And so this time I really yelled, and I said, Mom, something's wrong with me. I'm bleeding. And she said, yeah, this is bright red blood. She said, and your water hasn't busted the way that it's supposed to. Something's wrong with you. So we're going to call the ambulance. We're going to call them again. So she cleans me up again and get me downstairs. And this time, she told me to sit down. I said, no, if I sit down, I just feel myself releasing and giving birth here, and I don't want to do it here at home. And so I just stood up against my glass doors that's in my house, that's in the foyers, like in between the foyers and the front room. And the ambulance couldn't make it on time. So the fire department comes, and I asked the fire department, I said, oh, you're here to save me? Can we go on the fire truck? They said, no, we have to wait till the ambulance gets here. So it takes them about maybe 15, maybe 20 minutes to get me an ambulance. And when the ambulance comes and the attendants come out there to come get me, they don't bring a bed up to the house. They make me walk up to the ambulance. They don't even help me get on the ambulance. And the guy questioned me from the day before. He said, are you in labor because it says that you have a UTI? You had a UTI. I said, I don't have a damn UTI. I'm in labor. Help me. I'm cussing him out the whole time. I said, please help me. So he finally gets it. And I'm in pain, and I said, something's going on, I'm bleeding, I'm leaking. And the doctors come in there, and they said, what's wrong with you? And I said, I'm in labor. And they said, are you sure? Because we read in your charts that you just had a UTI. I said, I'm serious, I'm in labor. So they're not taking me serious, so I take my own pants off, and I said, what does this look like? And blood and fluid is gushing. And to add insult to injury, they put a sheet over me. So by that time, you done pissed me off so bad. I said, F this sheet. I'm in labor and my water breaks. And so by that time, then they wanted to play doctor and get their tools and help me push when I'm already pushing. And so by the time I push the baby out, the baby doesn't cry. So I instantly know something's wrong, and they take the baby out to the little back room. And I said, what's wrong with him? And they really can't answer right there and then. They said, we're gonna take him to the NICU. And so I asked the question. I said, can I get up and take a shower because I've been bleeding and leaking for a while, and I just feel sick. I feel, and they tell me no. And I said, why can't I get up and take a shower? They said, because you could hemorrhage to death because, oh, you had a placenta abruption. And besides the baby breaking his head through the sac, you had 2 holes at the side. So yeah, and you had blood clots in the back of your sac. So you had a lot of complications that we just didn't grasp or didn't know about, or we didn't know about.
How was, first of all, did your community health worker look like you? Was she African American?
Oh, yes.
She was African American?
Yes.
Was that helpful?
Oh, yes. Because one time when I met up with her, I was so out of breath one day, and I was hurting. And she said, she actually called, I forget his name, the head doctor that's at the clinic, because I was going to the clinic. She said, something wrong with her. I think you should check her. So we do that. And their conclusion was it was a UTI. That was like, I said, I'm not burning, something's going on. That was a UTI. Maybe it's just a UTI. They was just trying to throw pills at me and have me go on my way. So she took me over there, and then she called me back, and she said, what did they tell you? She said, because something was wrong with you. I said, they just said it was a UTI. And she said, no, something was really wrong with you. She was like, just keep going to your doctor. And so maybe like a few days later or a few weeks later, maybe a week or 2 later, the bleeding and the gushings really started happening. And that's when I was calling and said, no, something's wrong. And they just told me to put a pad on. I said, can I come up to the hospital? No, don't come up to the hospital. Just put a pad on. And so So that, the day that I did gush, I went to the hospital and they sent me on my merry way talking about it's a UTI. I said, no, this is not a UTI, and I took all the medicine. Something's wrong. I'm in labor. Something's wrong. And they just ignored me.
Was he born sleeping or was he breathing when he came?
He was breathing, and they took him to the NICU. And they came up maybe 30 minutes, maybe an hour, and I'm by myself. I have no family. I'm all by myself. And they come to be the bearer of bad news. Now listen to this. They came in and said, well, yeah, his lung development is not together. So it looks like your baby is gonna die from his lungs, just not fully being there or being developed. So I said, can I see my baby? And they said, yeah. I said, I'm gonna see I heard what you said, I can't get up, whatever, I can hemorrhage, but I'm going to see my baby. I don't care what happens to me, I'm going to see my baby. I'm angry. So a nurse takes me downstairs and I'm just watching over him and praying over him. And I get on the phone with my grandmama. And I said, Granny, I'm crying. And I said, Granny, you don't gotta worry about coming up here or whatever, but they said my baby gonna die. And she said, what? I said, they said my baby gonna die, I just need you to pray. And I was lucky because my Aunt Darnell was in town and she was staying at my grandma's house. And she said, no, baby, I'm coming up there, because at the time my mom didn't have a car, so my mom couldn't come and she had my kids. So they come up there and we're praying over the baby. And they had their pastor pray over the baby, and they said, would you like to baptize the baby? And I said, yes. And his rates is just up and down, going up and down. So I don't know if he's gonna make it or not, and I'm just praying. And my grandma said, well, your Aunt Darnell's gonna get your mom and your kids. So they come back, and my mom comes in the room. And I don't know if the baby was just waiting. The baby's waiting. I guess he heard her voice, and he's just smiling. Look like he's smiling. And she's talking to him. She said, baby, don't die. Like Gigi here. That's what all the kids call her, Gigi. And he looked like he looked over for a minute, and then he just died. And the nurse picks him up, and I'm trying to run off because I can't believe this. And they said, no, you hold your baby. You hold your baby. So I hold my baby. And the last thing I just remember is his warm body going cold. And I just remember that. And
so what is it you want other people to learn from your story?
one is your surroundings. Be aware of your surroundings. Like when you know you're not being treated right, I mean, stand up or speak out. Another thing is, I meet a lot of mothers in the community. They so frightened to say anything. There's a mother this morning. I had to calm her down because there was a lot of people that said, you crazy for talking about this baby, or you crazy for posting this. I said, no, she's grieving. Leave her alone. She's grieving about her baby.
I have two boys, 12 and 14 years old. I lost a daughter. She passed away when she was 4 months old. I had gestational diabetes. Other than that, I had a really smooth pregnancy. No morning sicknesses, it was a really smooth pregnancy other than the gestational diabetes. It was just SIDS. She went to sleep and just passed away in her sleep.
Wow.
But she was pretty healthy. She was a big baby, weighed 8'4". But I was pretty healthy. I had a regular physician, my OB, that I was seeing, and we had regular visits. I went to all the doctor's appointments, and they gave me, the regular ultrasounds. They did a little bit more ultrasounding closer to the 7th, 8th month because of the gestational diabetes, and sometimes it can cause the babies to get really big. So they kind of monitored her for the, weight, to make sure she wasn't gaining too much weight, and they might have had to take her early. But her due date was on the 9th, and she came on the 6th, all by herself. It was really hard. One thing, she did have a cold. She had caught a cold, and she was just congested. That was it. And she went to the doctor for the congestion. They ended up giving her medication for that. Actually, I hadn't even had a chance to give her the medication. She went to the doctor on a Friday, and so she didn't. I got the prescription filled. We picked it up on Sunday, and Sunday is the day that she ended up passing away that evening. But it was really hard. I mean, it was a very hard. I just couldn't understand it at first. I thought, well, maybe she was so congested that, it was just too much for her to, I thought different things as far as that was concerned, but that was another reason that we decided to do an autopsy, just to make sure that maybe she didn't choke on some phlegm or phlegm or anything like that. But they ruled it as the sudden infant death, so of course that's what we had to go with. No kind of stress at all. I worked, and I mean, the normal little stresses, like I don't want to go to work. I'm a hairdresser, so I can't afford to take off of work earlier than, different things like that. I can't afford to stay off for too long after I have the baby, and, that normal little stress, but it wasn't, I was at home with my mom, so it wasn't like I had a whole bunch of bills that were gonna, be not paid. So she was there for me for that. I just feel like I do have a calling on my life, and whatever it is, I'm here to help anyone. The strength that I was given was amazing to me, and I want to be able to give that back to any female or male or, anyone that loses a child. But it's hard in any situation, a child, a mom, but God, He gives me the strength to go day by day, and I just have to thank Him all the time, because it's amazing. It really is.
For me, my hopes and dreams really was I knew I wanted to be a wife. I knew I wanted to have a family, and somebody to do family-based things with, because that's how I grew up. I come from a large family. My mother was one of 10 children, and so I grew up really traditional. We got married. We had our first child together in 2002. He is now 15. 2005, we were expecting another child, and we lost her March of 2005. And then 3 years later, we decided that we wanted to try one more time, because we always discussed that we wanted to have 2 children together. He had no children when we met, and went to the doctor, talked to them, decided, got pregnant right away, and we had our last child in August of 2008. My pregnancy in 2005, I called the doctor. I woke up to get ready for work, and I noticed that when I went to go shower that I was kind of leaky or what have you. And I showered, got dressed, not wanting to be late for work, things like that. I put on a liner, panty liner, I go to work. By the time I get to work, I have to change it again, which I've never had to do with any of my pregnancies. So I wait till the doctor's office open, and I called them, and I was told, oh, you have an appointment tomorrow, we'll check you then. That's normal pregnancy discharge, so it's really nothing to worry about. I say, okay, I hang up, I continue to work, wait the next day, we go to the appointment, and at this appointment is when we were getting a 3D ultrasound, my first ultrasound for this pregnancy. And so we get back there, and the tech, looking, and she stops, and she walks out the room, and she goes and gets another tech, and then they both come in the room, and they're talking, but no one's talking to us. No one's telling us what's going on. James is in the room, and they both walk out. And then she comes back in. She says, "You can get dressed, but I need you to wait in the waiting room. Don't leave yet." And I said, "Okay, what's going on?" She said, "We'll be with you in a moment." We get dressed. We wait in the waiting room. Again, my mother is with us as well. We're probably in the waiting room half an hour, 45 minutes. And then the nurse says, "I need you to come back here to the office. Your doctor's on the phone." So I go in their office, I get on the phone, and the nurse says, "I need you to leave there and go directly to the hospital. Your room is already ready. They're waiting on you. Don't go anywhere else. Don't stop at the store. Go directly there." What's going on? They'll tell you when you get to the hospital. I hang up, we get in the car, I go. My room is right across from the nurse's station. We walk in, they say, "Get undressed." A doctor comes in, don't know him, never met him. And my mother is also there, and he is talking across me to my mother and saying, "We need to do this and this to her." And like I said, I don't know all the details, again, a blur. At this point, it's been almost 3 hours, and no one still at this point has told us what's going on with me or our baby. And so my mother states, "She's right here. You need to stop talking to me and talk to her and her husband and let them know." They're scared. It's been a few hours. Nobody knows what's going on. You need to talk to them. So I end up having a cerclage done. And I was told it's a 50-50 chance or what have you. Got it done that evening. Everything's fine. The next day, still fine. The second day, middle of the night, I moved to another room. I'm on the phone with him. We're saying goodnight. I'm checking on the kids and things. And I hang up and I get ready to go to sleep. And all of a sudden, I feel really wet. I just feel this warm sensation. And so I called my call light, and the nurse comes in. I said, "There's something going on. I just feel warmth." She pulls back the covers. She looks. She goes, "I'm sorry." She pulls the cover out. She turns and gets ready to walk out the room. And I say, "Should I call my husband?" And she said, "Yes." And she walks out the room. I call him and I say, "You need to get up here." I said, "Don't wake the kids. Just come straight to the hospital." He does. And it seems like now it's daylight. I don't know what kind of time passed. Now I moved into another room, and I have to deliver the baby. And so I'm being told, as I'm being prepped to push, because I had to go through the whole labor, if the baby is born and the baby is born deceased, we will pay for the burial. But if you have the baby and the baby is born alive and then pass, you're responsible for the costs. So all I remember. And I just remember my husband on one side of me, my family members, they rushed out, and I'm put in stirrups and I have to push. And I just remember these students and these doctors just standing up against the wall, just looking at me as if I was some kind of science project, watching me push this baby out, and we don't know the outcome. And so I went through the whole labor. She came out, and she was born deceased. So that was that.
Have you told Jimmy his story to other people before now, sitting down in this kind of detail?
Not so much in this detail.
Why not?
It's hard. It's hard, you know. But at the same time, I don't mind sharing, because I just feel that if that helps one family, one woman, to help them have a better birth outcome, then I don't mind sharing.
Have you shared
Nah,
openly?
no. I'm one, as she can tell you, I'm one of those close type of person. So, I mean, it's like she'll have to remind me, like when the month comes up, she'll be like, "You know what this month is," and this, we think about it, we talk about it, and it's just, I keep things bottled up. So I just wanted to be there for her. So I just kept my emotions to myself. Kind of just went with my normal routine, you know, go to work, come home, go to work, come home, and just be there for her. I really never got a chance to let my emotions go because I didn't want any more stress or anything around the house, so I just bottled it up and really just never released it.
We cried though.
Yeah.
When we left the hospital after Jamia, we got in the car and we're pulled away from the hospital, and I remember him calling his mom and letting his mother know, because she doesn't live in the same state, she lives out of state, and calling his mother and telling his mother at that moment as we were driving away from the hospital with no baby in the back seat, we both just broke down and just cried. And then after that, you know, we just kind of remembered her, embraced it. We talked to our children, you know, about the experience and what happened with me and why there was no baby, because at the time our youngest son was like 3, so he wouldn't understand so much, but our older 2 children, you know, and just kind of explained to them the best of our ability as to, you know, what happened. And I've just learned so much. It's like mind-blowing, actually. But just for my own, after my last pregnancy, just my own research and my own, you know, trying to find out, you know, about what happened, just telling my story and sharing it with, you know, whatever woman I see is pregnant can use some encouragement, because they may be going through some difficult times in their pregnancy. So just sharing my story in hopes that they know that it's somebody that has been there and that, you know, it could be a great positive outcome. I've experienced it. And what's interesting is I didn't know about the low birth weight zip codes and things like that until I started working for the program that I work for. And I'm like, looking back, I lived in those zip codes when I experienced, you know, my difficult pregnancies. You know, both of them, I lived in one of those zip codes. So I just found that interesting, how it just spoke to that.
We had 4 miscarriages, a successful birth with Amari, and then the stillborn. My story begins before I met my wonderful husband. My journey began when I was 24 years old. I was working in school and had a great job, no kids. And so my husband and I actually started dating around that time. And so I went to an appointment, an OBGYN appointment, and you know, obviously I was checked to see if I could have children and things of that nature. So I received a call from the physician herself. She called me at work and she said, you have fibroid, you have a condition called with fibroids, and you know, we're just gonna have to take them out. I was in a hospital for 3 days or so. I had the greatest care. I remember, I'll never forget, my husband and I we were sitting there talking, and it was over the weekend. He did the surgery like on a Friday. He called that Saturday afternoon to check on me, and he said, well, I'm out in my strawberry field right now, but we just wanted to check on you and see how you're doing. I'm like, wow, that's awesome. So we just had tip-top care. Okay. And then the blessing came again when, after we became pregnant, then we met another phenomenal doctor. So prior to our successful pregnancy, we lost, we almost stopped counting. Was it 4 babies prior to Amari? And you know, the first one, of course, was just tremendous, but they were miscarriages. And you know, you get excited, you know, we're pregnant, yay, and then, you know, 3-4 months later, you're not. So we just couldn't understand why. What was going on? You know, Walden tries to, he's strong, he's very strong, you know, he really supported me a lot, but he's like, you know, pick your chin up, we'll just try again. And we tried again and again. And so we just kept losing them. And then finally, with the care that we received from Dr. Carnitis and the follow-up care from Dr. Miller, we had that successful pregnancy. However, after Amari was born, and she was approximately, what, a year and a half, I became pregnant again. So I'm like, okay, here we go again. And so everything was fine with the pregnancy. I'll never forget the day. I was approximately 5.5 months, 6 months. I went in to get an ultrasound, and I noticed that the technician, she was nervous a little bit. And I don't know if it was just the peace that God instilled in me, but I know when I'm looking at this ultrasound, you normally see the colors red and blue. And red is where the blood is running through the baby, and then the blue were, I don't know what it was. But when we looked at the screen, it was completely blue. I noticed her hands started shaking. My husband was like, "What's going on?" And I was just touched him. I said, "Just wait." I knew that I had lost that baby. And so that was that. And then shortly thereafter, my doctor said, "You're on bed rest, you're done." Dr. Miller was like, "You're done."
Was that the time you were bleeding so much and the doctor said our doctor said, "Do not touch you," and he kept doing it? Remember that? What I'm talking
that
about?
was the E room. That was another time.
Okay.
Yeah, that was another time when I was expecting and I hadn't lost the baby yet. And
That's with Amari.
And the doctor, was that
Amari.
with Amari?
Mm-hmm.
Oh, when I was using the scope.
And you were bleeding a lot.
Yeah.
And we went to the emergency room, and because she was losing a lot of blood. So her doctor said, "Tell him not to," I can't remember the term for it, but not to go in her, not to bother her down there.
Yeah, they wanted me to do a ultrasound on the stomach instead of using a scope.
Right. So the doctor did it anyway.
Oh, yeah.
Remember that? I remember
Now I do.
she was bleeding so much. I'm getting mad thinking about it. She was bleeding so much that blood was like just squirting out. And I was like, well, the doctor said don't touch her, don't bother her down there. But the doctor was like, he didn't, and he was, whenever he doing, she was bleeding everywhere. And I was so upset. I thought we were actually going to lose the baby at that time, but praise the Lord, we didn't. We have Amari, but I remember that time, it's like the doctor was, this is my own personal opinion, he was arrogant, in my opinion, and he didn't want to listen to what her doctor said. And said, well, I'm going to go do what I need to do anyway. And I just remember her losing so much blood. It was like the look on her face. It was
I gave up.
It was just fear and desperation, and it was like the doctor was not listening to what she was saying at that time.
It was one of the emergency room doctors. We visited the emergency room, as you can imagine, quite a bit, and we were able to get our doctor on the phone the after hours, and so we were relaying the information because there was a lot of delay. And so Wadden was sharing with him what the doctor had said, and at that time I was just kind of out of it, and then I remember now.
Mm-hmm.
He was so upset. He knew that he was upsetting me, so he walked out because you called your sister for support. I think you were just upset. So upset. Yeah, because they closed they just stopped everything and then told me to go to bed.
Yeah, and sent her home. So I said, you did all that. The doctor told you not to do it. You did it anyway. She lost all the blood. Then you just told her to go home.
And then I lost the twin.
Let me just ask you straight out, do you feel that you had different outcomes with your pregnancy because of a pre-existing genetic condition, or do you feel that you have different outcomes because of what more black people living in Lucas County have than white people? What is your gut feeling?
I appreciate that question. And if you would look or take a survey, or probably any type of research would tell you that African American women have fibroids. So I believe it's more based upon not the condition, because outside of the fibroids, there was nothing else. I truly believe it was just more, my gut feeling was the treatment. I believe that racism may have played a part in it. I believe that just like when my husband shared with you about, we were trying to share with him to tell that emergency room doctor, do not do an inside scope, do an outside scope. We just had our doctor on the phone and he didn't listen. He just went ahead with it anyway. I believe those type of treatments, and they don't give value to you, could very well be because of the color of your skin.
One thing I've witnessed in my 49 years of life is a lot of times people don't care about your income or your degree. When they see you, they see a color. And unfortunately, sometimes people judge you on that. One thing I know I hear a lot when I heard about fibroids with black women, the first thing they'll say is hysterectomy. It's like they don't look at any other option but that. That's the first go-to that I hear doctors often go to is hysterectomy. And another thing as far as care, when you're at a hospital, even if you have insurance, even if you have an income, when they see you, they just see you as, you know, beneath them. And I don't care what you say or what your thoughts are, I'm going to do what I think is right. Like in the situation with the doctor at the emergency room, even though he could see that we had talked to our doctor, we had our own doctor, we gave him instructions. He was basically, how dare you tell me what I'm supposed to do? It's almost like he wanted to prove a point. And when I think about it, it's like, what could I have done at that time? Should I have stopped him myself and said, no, you're not going to touch my wife? You know, like what options did I have at that time? My wife is laying there bleeding on the table. So like, do I listen to this man? Do I stop this man? You know, what are my options? And I have a degree, you know what I'm saying? I'm an educated man, but I still sometimes don't know what my options are when I'm in a hospital, in the emergency room. And that's why I say now as I get older, don't be afraid to speak up. I tell my daughter, if somebody tells you no or something happens, don't be afraid to question it. You know, don't be afraid to be ridiculed because you're speaking up. Ask questions, speak up, let them know, hey, I have a question about this, whether it's a stupid question or not. Why are you doing this? What are my options? What are my choices? You have to ask. If you don't speak up, you will get passed over, you will get walked on.
And he's absolutely right. We have a strong belief in God. We couldn't have really made it this far. We've been married 20 years now, and we wouldn't have made it this far without that belief. I'm surprised you didn't bring up, I honestly wanted to name my daughter Victoria. But when the baby became viable, Walden really stepped up. He said, no, we've been through too much. We have to make her name mean something. So our daughter's name is Amari Iman. Iman Walden picked because it means faith. And that was the faith that was depicted upon having her. Amari is a version in the Bible of Amara, and that means God's precious gift. So when she was born, she would tell people, my name means God's precious gift and I'm full of faith. She probably would cringe to hear that, right? But just having her, she's a joy to us.
Infant mortality, it's silent, it's real, and you can make a difference.
I think that it's really important for people to recognize that a healthy pregnancy or a healthy birth outcome really starts before a mom ever becomes pregnant. And a lot of that is their overall health, but also their stress levels before and during their pregnancy. So when we look at addressing social determinants of health when they're pregnant, when a woman or family does not have their basic needs met, so that food, clothing, shelter, transportation, if they're living in a domestic violence situation, they have significantly higher stress levels in their lives. They have a lot more obstacles to even getting to the doctor than that woman who doesn't have those issues. That's really where we emphasize that African American women have these significantly higher rates of babies being born premature, low birth weight, and babies dying because of stress that they have faced throughout their entire life up to this point. So from discrimination, from racism, whether that's overt or covert that they've faced over their lifetime, from the time, even before they get pregnant, their chances of having that poor birth outcome are 2.5, 3 times higher than that white woman in that same situation. You know, some people don't want to recognize that that's true. Some people don't want to recognize that race plays a factor in the health of babies that aren't even born yet. But what we're actually seeing is not only does the stress from that mother play a factor in their infant, but if that mom is pregnant with a female, then that mom's stress and the racism that they face and the discrimination plays a factor in that next female's reproductive health as well, because all of their eggs are in that mother.
And I think too there is some responsibility on the healthcare professionals to just being aware of your implicit biases and being able to sit them to the side and provide the same care you would give to your own loved one, you know. I think that's, for me, that's all I'm asking for myself and our participants that we serve. Treat them and give them the same care you would give to your wife, your sister, your cousin, your mother, because they deserve that. I think it's important to know the population you're serving. So if you work in Central City, Toledo, you need to be aware of the population you are serving and making it your business to understand where people come from. And I think if we can do that as healthcare professionals, we would really do our patients a better service.
So in general, you know, if we address the social determinants of health, then we get a really good understanding about, you know, where those patients live and how we can help them the most. We actually take the highest risk patients and they all of a sudden start to see outcomes that approach that of the national average just because we address the social determinants of health. We do that by referring those patients to the Pathways Hub, and then the Pathways Hub can help meet that immediate need, and then they also can link that person with a community health worker. And when they link that person to a community health worker and or help them find services, what we see is patients that enroll in our program that we link actually have a preterm birth rate and preterm delivery rate that starts to approach that of the national average. And we screen them for risks, for pregnancy risks, but we also screen them for social determinants of health. We look at transportation, domestic abuse, do they have a home, do they have a job, things like that. Can they access care? Do they have appropriate access to care? And then we try to meet them in those situations.
So the mission and the vision of all of this really is to decrease infant mortality in Toledo-Lucas County. I would like to see Lucas County be the leading the pack in reducing and along the lines eliminating infant mortality. We have a lot of resources in our community. We have the Pathways Hub. We have Help Me Grow here in Toledo-Lucas County. We have McV, which stands for Maternal, Infant, and Early Childhood Home Visitation Programs. We have Moms and Babies First. We have Healthy Start, and we have Early Head Start. These are all home visiting programs that work with women in our community to provide them with education and connecting them to the other resources that we've talked a whole lot about, social determinants of health. These are programs where these individuals will have a educator, home visitor, community health worker that works with them one-on-one and their entire family. These programs should be busting at the seams. We should all have waiting lists, and that's not the case.
My hopes is just that this documentary will bring more awareness about our infant mortality issue in Lucas County. The residents of Lucas County will be able to put some real life experiences, real life stories, faces to our problem here, and it will maybe motivate them to become more involved in our efforts to reduce infant mortality.
Take the time to understand. Check your own perceptions and biases. Tap into the resources that are available here in Lucas County. Together, we can build a healthier community.